On Primetime Politics tonight, the House of Commons holds an emergency late-night sitting on the ravages of the pandemic's third wave in Canada and what more the federal government should be doing to try to bring it under control. MPs will be here to debate that. COVID conflict in Ontario. Top science experts are calling for tougher measures to curb the third wave in the province, but is the government listening? On a day when the Premier goes into isolation after a COVID-19 exposure. And a guilty verdict in the police killing of George Floyd in Minneapolis puts the spotlight once again on racial injustice. Black parliamentarians will join me to discuss the ongoing fight for equality in this country. We'll begin tonight with the ongoing COVID crisis in parts of Canada as the third wave of the pandemic keeps spreading and the strain on provincial healthcare systems keeps growing. The New Democrats pushed today for the Prime Minister to invoke the Emergencies Act to step in to the province of Ontario, where the Ford government is under fire for its pandemic response. And Conservatives pressed again on vaccine supply today and travel restrictions in question period.
We're in a race against variants in this third wave, and we're losing because we didn't have the vaccines needed in January and in February. In fact, we still don't. But the Prime Minister is now not even restricting flights from COVID hotspots to stop the entry of new dangerous variants. The Prime Minister failed at the border last year. Why is he failing again?
The Right Honourable Prime Minister.
Mr. Speaker, as I said, we've delivered more than 13.6 million doses of vaccines to provinces and territories. We actually passed by about 50% our targets of delivering 6 million vaccines by the end of March, and we will continue to deliver more and more vaccines to get Canadians through this. On the borders, we have some of the strongest measures in the world on the borders, but we will also continue to look at other ways based on science and data to keep Canadians safe. Importation from the border is a fraction of the cases we're coming in, but we will still make sure we are doing everything necessary to keep Canadians safe.
And Canada may be getting more vaccine help from the United States. The Prime Minister and President Biden spoke for about 30 minutes today. Canada's already received 1.5 million doses of AstraZeneca vaccine from the U.S., which now has an abundance of supply. The President suggesting today more doses for Canada will be on the way.
We're looking at what is going to be done with some of the vaccines that we are not using. We got to make sure they are safe to be sent, and we hope to be able to be of some help and value to countries around the world. I've talked to our neighbors. As a matter of fact, a fellow who's working really hard to take care of his country and deal with this, I was on the phone with for about half an hour today, and the Prime Minister of Canada, we helped a little bit there. We're going to try to help some more.
So challenges on the domestic pandemic front are mounting. Questions about vaccine supply and rollout and public health orders, and the federal government facing calls to look at banning international flights from India in particular, where a new variant may be fueling a massive outbreak of cases in that country. That variant has now been detected in Canada for the first time in a case in Quebec reported today. Let's bring in three members of Parliament now to discuss the latest developments on all of this. Greg Fergus is the Parliamentary Secretary to the Prime Minister. Eric Duncan is an Ontario Conservative MP and the Question Period Coordinator for the Official Opposition. And Lyndsay Mathyssen is an Ontario New Democrat MP and her party's Deputy Whip. Should have said Greg Fergus is a Quebec Liberal MP. So good to see you all. Thanks for being here. Mr. Fergus, let me start with you. The debate's focused on where to place the blame a lot these days for a third wave that is ravaging many provinces. Is it vaccine supply? Is it how the provinces are administering vaccines? Is it a lack of proper restrictions? The country's in a tough place, so how can political leaders get us through this?
Well, I think the way the political leaders can get us through this is to cooperate and work together, which the provinces and the federal government have been doing since day one. I think if we were to look back, Peter, to the early days of the pandemic, you saw that Canadians were really impressed how we all came together to work together to making sure that we can all get through this.
Do you think that's been lost now?
I'm sorry?
Do you think that's been lost now, that cooperation?
Well, I think I think cooperation between the provinces and the federal government has been excellent. Our officials meet every day. We're making sure that we're coordinating the vaccines that are coming into the country. We've been doing very well in bringing in more vaccines than we had originally scheduled, so that we can get jabs into people's arms, so that they can get that protection which is necessary to bring down the rate.
All right, Mr. Duncan, Conservatives are blaming the state of the third wave and where we are largely on either inaction or the wrong actions by the government, including on vaccine supply. But the vaccine supply was known back in January. In fact, it's been exceeded, as Mr. Fergus points out, not without delays. Let's be clear about that. But I'm wondering if you think provinces have done enough to manage that vaccine supply by making sure they're vaccinating the right populations at the right time and putting in the right restrictions and even benefits in place till everybody's protected.
So, Peter, on the goals and the targets that the government set for themselves, respectfully, when you're talking about having in the first quarter 2% of Canadians fully vaccinated, I mean, the goalpost is so low you can almost trip over it. And I think you take a look at the U.S. and the U.K. models in terms of how they ramped up, vaccinating in the U.S. more people per day than were done in the entire pandemic for many parts, and still, in that case, happening in many different ways.
I mean, they're now starting to talk about oversupply in the U.S. to the point where the president's talking about sending more vaccine to Canada.
Absolutely, and I'll show you the example. We talk about what more can we do. I'll give Brian Pallister in Manitoba credit, working with the North Dakota governor to get 4,000 truck drivers both doses of vaccines in the next 6 weeks. The provincial leaders, our premiers, are showing more leadership working with the United States and neighboring governments to help get more of our population. And I mean, you have to get the line you just have to roll your eyes at a couple of weeks ago, Peter, when there are zoo animals in the United States, they're going to get vaccinated before Canadians.
All right,
I think there is an oversupply in that, and there's federal leadership is needed.
Okay.
The premiers are stepping in where the federal government should be.
Lyndsay Mathyssen, I'm not sure you see it the same way in the province of Ontario. Your party wants the Prime Minister to invoke the Emergencies Act and get more involved in the pandemic response in the province. What should the federal government do that the government of Ontario is not doing?
Well, this is actually a perfect example of what Greg was talking about in terms of working together. If the Liberal Party would actually listen to some of the good ideas that New Democrats have, this is one of them. The putting forward of the Emergency Act would allow better coordination of that the vaccine rollout, getting it to people who are underserved, who in neighborhoods where they're frontline workers, they're essential workers, and have the highest amount of breakouts or cases of COVID-19. It would put all hands on deck in terms of being able to get that through for the people who need it. It would allow for the emergency paid sick leave and for the federal government to step in, because unfortunately Doug Ford isn't taking that lead on paid sick leave that people need.
Let's bring that. That may be changing in the province of Ontario on the sick leave issue. But Mr. Fergus, the experts in Ontario say that the big spread problem is in workplaces and in essential workplaces. And we're going to hear from the head of Ontario's science table in just a moment, who says the federal sick leave plan for the pandemic's been a failure. In fact, it's actually making matters worse because it's too complicated and hard to access. What's your response to that?
Well, I would say, first of all, I don't think the response should be the emergency approach. I think all hands are on deck. The federal government has made it very clear that we're willing to help out, especially hard-hit Ontario, and working with other provinces to bring all the resources to bear to get Ontarians vaccinated. My province is Quebec, but I get to see what's happening across the river in my neighbor in Ontario. In this budget, we've extended the EI sickness benefit from the current level to 26 weeks. We've always offered to do whatever we can to help the provinces to protect their citizens and to get vaccines.
Right,
in
but
their
we're going to hear
arms.
from the head of the science table in a moment, who's going to say the problem is it's hard to access the federal program, and employees are not are going to work sick in essential services because they can't be guaranteed they're going to get a paycheck from their employer, or that they're going to get compensated for the day they miss. So we'll hear more of that in a moment. But Mr. Duncan, let me shift to airplane flights here. We now have what's been happening in Canada over the last couple of weeks. 100 flights into Canada have carried at least one positive case of COVID-19. 35 of those flights from India. Should we be banning flights from India?
Well, the reason we're having to look at this now, again, Peter, is the failure of the Liberal government to get vaccines to provinces. I will say last year we called for strict border measures very early on, and it's very concerning, another variant in India and what is going along on there. The key to getting out of this about hotspot in different countries, the key model of success that other countries who have been successful in getting case counts, getting hospitalizations down, is vaccines. That needs to be the number one federal thing right now that we need to be doing. That needs to be the focus. That is the single biggest measure, and it's one that the Prime Minister, this third wave, is the Prime Minister's lack of leadership on this, and making it very clear.
Should we be banning flights? Should we be banning flights from international destinations?
I would agree with what Eric was saying. This is about getting ahead of things, and this is about getting those vaccines into people's arms. We could have been ahead of all of this, and right now the province is talking about only being at 58% of efficacy. You can go in and they're having to like the vaccines aren't the clinics aren't full. Some of the vaccines are going to waste, and ultimately that's about the rollout, and that's about the efficacy of it. So we come back to the fact that we need to work together with the province, especially in Ontario, my home province. I am terrified for the people in my area because they aren't getting, those frontline workers aren't getting the vaccines that they need. And
I just want to hear quickly a final from Mr. Fergus on this. The Prime Minister's talked of possibly looking at more restrictions on the border and on flights. Should we be banning flights from India now?
Well, I think Canada has the toughest measures in place where we require people not only to have a test before they get on a flight, but once they land in Canada, they get a test. They have to stay in a designated hotel until they get the results of those tests. And then they still have to continue isolating themselves at home and being verified by people. So
we still have COVID-19 arriving in the country from international destinations.
But if everyone
some would say you can't stop that. It's going to happen at some point. You need to be protected. That's the key.
I think the best thing for people to do, and is to making sure that we listen to our health care authorities, that they do isolate at home for 14 days if they come in from outside of the country, to make sure. That's all it takes. It's those simple measures to making sure that the disease doesn't have an opportunity to take root in Canada.
We'll have a chance to follow this up. We're going to continue talking about this, we know. So Greg Fergus, Eric Duncan, Lyndsay Mathyssen, thanks for your time tonight, and look forward to talking to you again.
Thank you.
Thanks, Peter.
Thank you.
Let's turn now to the latest on COVID-19 across the country. Some provinces continuing to face high numbers of new infections and continued strain on their healthcare systems. Ontario today is reporting 4,212 new infections, a sharp increase over the almost 3,500 cases reported Tuesday. It's also reporting 32 more deaths. Almost 800 COVID patients are in intensive care, the highest number since the pandemic began. Quebec is reporting 1,217 new infections and 5 more deaths. Canada's Chief Public Health Officer says the discussions continue across the country about efforts to send more health workers to the province of Ontario.
We do have underlying protocols and policies that support mutual aid between provinces and territories. And absolutely that is a very live part of the discussion with Ontario right now.
Well, let's focus on one of the hardest hit provinces, Ontario. The Premier, Doug Ford, is in isolation after being exposed to a staff member who tested positive. The Premier so far has tested negative. He's facing heavy criticism over his response to the third wave and more calls for the right kind of restrictions and benefits such as paid sick leave for essential workers to curb the spread of the infection in Ontario. Dr. Peter Juni is the head of Ontario's Science Table, created to advise the Premier on how to tackle COVID-19. This past weekend, he came close to quitting that role, and he's with me now. Dr. Juni, first of all, thanks for taking time to speak with me. It's good to see you. Look, new infections in Ontario jumping again, over 4,200 today. There are a record number of COVID patients in intensive care, almost 800. How close is the province's health system, do you think, to buckling under that continuing strain?
I can't possibly tell you. It's a really, really challenging situation, and the major issue here is we need to be aware of, even though now we have, a little bit of an indication that the curve is flattening, this doesn't mean that anything changes. Right now, a continued increase in ICU occupancy is just baked in for several weeks, and even which won't happen, we were able to make case numbers plummet from tomorrow onwards, as it has happened, for instance, in Ireland. It would still take several weeks during which the occupancy in ICUs would go up and up. We will be way above 1,000 ICU beds occupied by patients due to COVID-19 before things start to go down, even if we get this under control now and start to get these numbers down.
So we're in this for a while. Do you believe there are calls here in Ottawa again today that the Prime Minister should invoke the Emergencies Act and take a more active role in the pandemic response in Ontario? You've been critical of that response. Have we come to that? Do you want to see the Emergencies Act and Ottawa more involved?
Look, I'm completely incompetent to answer this question. What I can tell you is that, governments all across the world actually are struggling right now. And, the point there is we need to understand that this wave that we're in, dominated by these new variants of concern that are 40% more transmissible, doesn't allow political compromises anymore. And we're not the only ones who struggle here. We need to be aware of that. What does this mean? During wave 1 and wave 2, where we had just the traditional variants, you could sort of compromise, and who could have, some considerations that would also just make a compromise and a concession regarding some political aspects that I'm actually incompetent, to cover. The problem is, if you have now a variant that is 40% more transmissible, you will not be able to sort of muddle your way through, with measures that are not completely stringent. Sure. And that's what's happening now. And it's not only happening here. I'm Swiss originally. I see things, again, start to go wrong quite a bit in Switzerland. I see, people, in elected officials just really struggling all over the world to do the right thing. The problem is, if you compromise now, you pay it dearly and your people pay it dearly.
Okay, the Ford government's been reluctant to implement a legislated paid sick leave program for essential workers because there's a federal program. Now the Premier's reconsidering. Why does Ontario need a legislated paid sick leave if there's a federal program?
The federal program is a really challenging concept that doesn't work. We need to face it. I'm afraid to say it was probably counterproductive. Why? You need to look at that from a very practical perspective. If I am an essential worker working in a warehouse, for example, and I wake up this morning with a sore throat, I need to be able to call my employer and say, I have a sore throat, I need to stay home, I'm sorry, and I need to have a guarantee that I get my paycheck on Friday. If this is not happening this way, the entire concept of paid sick leave falls flat. We have a lot of people in this province who actually are struggling and really just live from paycheck to paycheck to be able, to pay the rent, to put food on the table of their kids, etc. And any threshold, that is too high, like a delay in payment, or perhaps, no guarantee that you get paid, or any administrational issues there, that doesn't work. If you look into European countries, what you see is a very uncomplicated system. Mm-hmm. It's the employers that pay, and they look after the money later.
Okay, we think Ontario is bringing something on, so we'll wait and see whether it meets the bill or not. But if we look at, we've heard from you a lot in the news lately, because you've spoken out about the shutdown of outdoor activities that the Ford government introduced. You said that wasn't your advice; that was the wrong approach. That we really needed to focus on indoor activities more than outdoor activities. And you talked about you almost quit your position because you said politics is guiding the pandemic, not science. But a lot of people, this is a political channel. People know that politics is played to get an advantage. So what advantage is the Premier getting by making decisions they're seeing him be attacked by all sides?
Yeah, well, again, I'm unable to comment on that directly. What I just realize is, if you have a situation like the one that we're in, that is really precarious, if you deal with this by, just having, again, political considerations, it will be very challenging to get it under control, and this will eventually backfire. I think that's a real issue here. What I saw, end of last week was really measures that showed that the nature of the pandemic was poorly understood. This pandemic has two major characteristics that are relevant for this province right now. One is it's now a pandemic of essential workers and their families. That's where paid sick leave comes in, and a clear distinction between essential and non-essential workplaces. And the other one is it drives indoors the virus and not outdoors. Meaning you have these two concepts that you just need to tackle properly, and that's a lot of common sense, a bit of science.
But very quickly, so you're saying, not invoking provincial sick leave is playing politics?
No, I'm not talking about playing politics, but what I see is everybody struggle, from my layman's perspective as a scientist worldwide, politicians, is that they do not appreciate that this wave that we're in right now is different than before. And if you have political considerations that you take into account in addition to science and the current epidemiological situation, you're unlikely to get the pandemic under control, and this will eventually backfire for everybody.
All right, hearing you on that. Thank you so much, Dr. Juni, for your time today. Appreciate it.
You're very welcome. Thanks for having me.
Well, the guilty verdict for the Minnesota police officer in the murder of George Floyd is still resonating in Canada, including on Parliament Hill and with politicians. Minneapolis police officer Derek Chauvin was led from the courtroom in handcuffs after being found guilty of murdering George Floyd by kneeling on his neck for more than 9 minutes. The guilty verdict is seen as a step forward in the fight against racial injustice, but only a step. Much the same way it is being viewed here in Canada. I'm joined now by two members of the Parliamentary Black Caucus. Quebec Liberal MP Greg Fergus is the chair of the caucus, and Senator Wanda Thomas-Bernard is a member of the Progressive Senate group representing Nova Scotia. Thank you both for taking time to be with me this evening. I do appreciate it. Mr. Fergus, let me begin with you. What was your reaction when you heard this verdict?
Relief. It wasn't joy, it wasn't justice, it was just relief. Too often we've seen in many cases where, in the case of the United States, African Americans have been killed by police officers. There isn't the videotape proof, and even sometimes when there is proof, the verdicts from the trials are not what most people who are outside of it would see, would expect. So it was really relief that the evidence and the verdict matched up.
Senator Thomas-Bernard, what about you? What was your reaction when you saw this verdict come down?
I agree with MP Fergus. I felt a sense of relief because I was very worried that there would not be a guilty verdict. And then, of course, worried about the impact that would have around the world. Because the murder of George Floyd certainly set off a global awakening about the reality of police brutality against African people. So the evidence that we had, thanks to the bravery of this young woman, and I'd like to say her name, Darnella Frazier, this 17-year-old videotaped that. And she was in the presence of her very young cousin. So I felt a sense of relief because I hope that for those directly involved who witnessed it, I hope that it brings them a bit of peace. And also for Mr. Floyd's family, but for all of us who witnessed this over and over and over again.
Right.
I felt a sense of relief.
Mr. Fergus, why is this verdict in the United States so important to a Canadian audience?
I think it's so important to every audience around the world. I have to tell you, Peter, that when that videotape had come out, it really sent a message. It sent a message that my life doesn't matter. It doesn't count. It was traumatic to watch that. It sent me into a depression. And the only way I got out of it was seeing so many other people, not just blacks, but a lot of my fellow Canadians, white Canadians, stand up and say, that's just not on. And to see that same movement, not only in Canada, but around the world, people saying that just doesn't matter, that's just not a reality we want to be part of anymore. We can see that racism kills, and we want something to be done so that we can live in a better society. That's what brought me out of it. Okay. I think that's the reason why it matters to people in Canada and matters to people around the world.
Senator Thomas Bernard, if I can, let's talk about what's happening in this country and the need to deal with problems in this country, and focuses on systemic racism and discrimination. This week's budget was a chance to do more. A total of nearly $500 million has been earmarked for the additional investments and changes in black community support programs, enhanced collection of race-based data, public service recruitment, mental health supports, and black entrepreneurial organizations. Do you believe that's the kind of spending that will begin to help to deliver change?
That's part of it. And it certainly is a significant part to have money earmarked specifically to address these issues is very, very important. Now, of course, the rollout of that in terms of how it happens, how funds are allocated, the conversations that need to happen within communities to ensure that the right actions are being targeted to the right communities in ways that are really going to make a difference. But beyond that, we also need to see a cultural shift, not just in policing, but in all of our organizations and all of our institutions where we know that systemic racism exists, that where we know that systemic anti-black racism exists. We need to have change in those spaces so that when decisions are being made, when policies are being developed, they're developed with a different set of lenses so that we take the totality of these issues into account.
Mr. Fergus, what's your view on that? And where what you see, I mean, the spending in this budget, is that merely a beginning?
Well, it started in 2018, and the 2019 budgets were, for those two budgets, for the first time ever, you saw spending that was directed at Canada's black communities. But what we've seen in the 2021 budget is that the Prime Minister really made a strong engagement, and he took it up, a quantum level in terms of support to say that black lives do matter. And we do have a problem. There is anti-black racism which exists in Canada. There is systemic discrimination which exists to many different racialized and Indigenous communities. And we need, if we're going to fight climate change, if we're going to build a sustainable economy, well, we all have to be there together. And this is the reason why we're making these investments now. The senator is so right. It's more than about the money. It's also about the attitudes that we have, and that changing people's minds and hearts on how they see black communities and how the black community sees ourselves as well. And I know after traveling this country, this great country, that black people want to contribute to the prosperity of our country.
Senator, let me finish on you. The greatest challenge, of course, of change is a lack of momentum and something that can make it stall. Is what you're seeing in the country now, are you heartened by where you think we're headed, and do you feel a sense of momentum, and what's required to keep it going?
I feel a sense of critical hope, and that's important. That can shift for me. And I think it's a shift for others when you feel a sense of hope, a sense of critical hope, then you feel that change will happen. And if we have essentially all hands on deck working towards the same types of changes, then I think we have some momentum building. And we do see this building. We need more. More needs to happen, obviously. But I think that we're on a positive path forward.
All right, MP Fergus and Senator Thomas Bernard, thank you for your perspectives this evening, and I know and I hope we'll get a chance to talk again, but thanks for your time tonight. It's been good to speak with you.
Thank you, Peter.
That's all the time we have for this edition of Primetime Politics. I'm Peter Van Dusen. For all of us here at CPAC, thanks again for watching.